Hello, I just wanted to add also, let me add this. Singular monticulus. Now that is a medication. I know you guys have seen it all over the commercials. Oh, it helps me breathe better. Oh, my breathing is so much better. Well, guess what? You got another thing coming. This is the black box warning that they added to monticulus, also known as singular, to again, an asthma medication to help you breathe, right? To prevent asthma attacks, right? So this is coming from their black box warning, their package insert. Serious neuropsychiatric events. Now, this is just one medication. There's multiple that cause this syndrome, AIDS. Now, highly variable serious reactions reported, including but not limited to agitation, aggression, depression, sleep disturbances, anxiousness, disorientation, attention disturbance, dysphonia. Dysphonia is when you're seeing things big, okay? Hallucinations. Dysphonia is where you're talking different, like your voice sounds different, okay? Hallucinations, irritability, memory impairment, obsessive compulsive symptoms, restlessness, somnambulism. Somnambulism is when you're sleepwalking. And you know, a lot of things can happen when you're sleepwalking. You could wake up to a red mess because you're sleepwalking and you think you're fighting something in your sleep and you didn't conquer it. When you wake up, you find something that's not so great. Somnambulism, tics, tremors, suicidal thoughts and behavior, and suicide. Events reported in adult, adolescent, and pediatric patients with or without a history of psychiatric disorders. Events reported mostly during treatment, but some seen after discontinuation of the neuropsychiatric mechanism, after discontinuation. Neuropsychiatric mechanism not well understood by the people who are telling you to take this stuff, and by the people who made the stuff. Okay, that's causing this neuropsychiatric events. Benefits of treatment may not outweigh the risks, especially in patients with mild disease symptoms and adequately treated with alternative treatment. For allergic rhinitis patients, now come on, wait a minute. My nose is dripping, okay? And you think that if you tell me that I might have this, a risk of developing this, that I'm gonna take the medicine? Come on now. Nose could be a faucet, all I care. Come on now, make it make sense. Allergic rhinitis patients. Reserve treatment for patients with inadequate response or intolerance to alternative treatment for asthma or exercise-induced bronchoconstriction patients. Consider benefits versus risk before prescribing. Discuss potential benefits versus risk of treatment with patients and caregivers. Advise patients and caregivers of need for close observation. If behavior changes, new neuropsychiatric symptoms or suicidal thoughts, behavior occur, discontinue treatment immediately. And contact provider. Continue to monitor signs and symptoms and provide supportive care until symptoms resolve. Now, it'll be good if your provider knew about this, because most of them don't. Most of them are ignorant to this fact. Now, before for the pharmaceutical company, this is really woo. Before the pharmaceutical company will put something like this as a black box warning, you had to have a slew, an inundation of these events taking place for them to even acknowledge what their medication can potentially do. Okay? So, in saying that, please don't think that this medication is candy, because it's not. It's causing chemical imbalance in the brain. It's causing the brain to, you look like my brother, you look like my mother, but you're not, because of the chemical psychosis that's going on. So please understand the risks and make sure that the benefits outweigh the risk before you consume or take anything. Okay? Stay prayed up.